Welcome to the July 7th, 2020 media advisory relative to COVID. Thanks for joining in on Cable 14 and those that are live streaming and the media that's participating as well. Thank you all for being here. Some announcements from the provincial side. The province introduced a bill today, which, if passed, would allow the government to extend some pandemic emergency orders over the next year. The proposed law would allow the government to extend or amend emergency orders a month at a time, with the law expiring 1 year after it is passed. If this bill is passed, it would allow the government to turn parts of the province back to earlier stages of the pandemic lockdown if required, which certainly we don't want, but that certainly gives them the authority to do that if that's necessary. And the government could also extend the redeployment of healthcare staff and change public health orders limiting social gatherings. So those provisions will still be in the Act, but the state of emergency as it stands today is set to expire on July the 15th. And it's my understanding that the order and bill would replace that state of emergency when that gets approved. On the city updates, yesterday, the mayors and regional chairs representing the Association of Municipalities of Ontario, as well as Marco and Lumco, regional chairs of Ontario, and the large urban mayors, as well as the Greater Toronto and Hamilton area mayors, we issued a renewed call to seek immediate provincial and federal support to cover our lost revenues and additional costs caused by COVID-19. We know this has been an ongoing discussion between the federal government and the province of Ontario. The FCM, Federation of Canadian Municipalities, suggested that they needed to secure some $10 billion in emergency relief for Canadian municipalities right across the country, funded 100% by the federal and provincial governments. So we're hoping that they have that ongoing dialogue and start helping municipalities sooner rather than later. The time for that commitment is unfortunately running out. Now we're halfway through our budget year, and municipalities have no choice but to consider plans to balance the budget by raising either property taxes, user fees, or charging or cutting services significantly. All of those are not optimal opportunities to help our economy recover. So we're optimistic that our government partners will not miss this opportunity to provide the emergency funding municipalities need to guide us through this pandemic and thereafter. Also pleased to share today that mandatory face covering bylaw will be coming to the Board of Health on Friday. The bylaw was created to protect the public from potentially spreading the virus to each other while in indoor public spaces, including commercial areas, retail spaces, places of worship, community services, as well as it already is in place in public transit or the HSR. So face coverings are defined broadly as more than just masks, but includes bandanas, not bananas, but bandanas, scarves, covering the nose and mouth and chin, and not leaving any gaping holes in that coverage. The exemptions will be, as it is in transit today, children under 2, and exemptions are also for people with underlying health conditions that prevent them from wearing a mask. So that I expect that council will unanimously support this going forward, and I know that there's broad community support for this as well. There are, as always, some opposition to that, but I think it is a protective measure that is going to be very, very important for us going forward as we open up more facilities in our community, and that virus is still very much out there, and the vaccine has not yet been produced or developed. So this may be our new paradigm, new norm, face masking for quite some time. So get your designer masks ready and be prepared to put them on when you go to indoor public spaces. Some good news on waterfalls and their associated parking lots right across the city. They will reopen on Wednesday, July the 15th. So all of them except Hughes, Webster's, and the Dundas Peak, largely as a result of the shuttle bus requirement in those locations, which gets very complicated and difficult and puts people in confined spaces. So the Hughes Falls, Webster's Falls, and Dundas Peak will not open. All others will. And the restricted use of those shuttle services, as I mentioned, is part of the problem for those 3 locations. But also, while you're enjoying those other waterfalls, remember to maintain a physical distance between yourself and others while visiting these popular areas. Critically important that we bear in mind that that virus is still very much out there. So either Even for those with underlying health issues, if you're out and about, masking will be important for you to do even when you're in outdoor spaces. The mandatory ban on outdoor water use for all non-essential watering is in place, hopefully until Monday, July the 13th. This means that people should not water their lawns or use sprinklers or fill large pools or wash their cars at this point. The ban applies to all parts of Hamilton. Residents can still water their flowers or their vegetable gardens. All that money you've invested in those two are important to water with either a watering can or a slow watering from your hose. The bylaw officers did provide education over the weekend on the mandatory water ban, but no tickets were issued. We will keep the media and public updated on this evolving situation via social media, press releases, and on the hamilton.ca website. And I want to thank residents for your help on this. It is, an unusual circumstance that as a result of some construction that was intended to be finished much earlier in the spring, long before the heat wave hit, and as a result of pandemic and other delays, that hasn't been possible. So hopefully by Monday, we will have that issue sorted out. So in the meantime, preserve that precious water supply of ours. I think the ability for us to treat it isn't as high as it could and should be, and the consumption is going through the roof relative to the heat. And so please be mindful of that. We don't want to run out of good potable water, and our staff are doing everything possible to ensure that all the reservoirs is as filled as they can be. And the temporary 30-minute free on-street parking has ended with the enforcement of all meters now back to normal. And we have a new pay by phone parking app, which allows you to pay, track, and extend your parking time anytime on all street parking meters and municipal parking lots in Hamilton right from your smartphone. So get the app, download the new Passport Parking app from the App Store and Google Play Store to create your account, and then park anywhere you see the Passport Parking app sign, enter the zone number, track or add time to your parking directly from your smartphone. Payment by coin on meters and coin credit card in off-street lots will remain available for those that want to use that service. And lastly, some sad news from the organizers of the Hamilton Santa Claus Parade, who yesterday announced the cancellation of the 2020 Santa Claus Parade. Very sad situation, but after 45 years of history, they will not be holding it this year, but are looking forward to having an even more spectacular parade in 2021. So unfortunately, even Santa Claus has been affected by this pandemic, and it adds to a long list of events that we're not going to enjoy this year, but we'll certainly put extra effort into ensuring that we're able to enjoy them all next year. Our illustrious Emergency Operations Center Manager, Paul Johnson, is with us. And Paul, you are going to give us some updates from the EOC perspective, please.
Well, thanks very much, Mr. Mayor, and just a few updates for folks, but generally we're really pleased with the way we're reopening some of the services. I'll go over a couple of those in just a few minutes, and that continues to be our focus at the EOC is this gradual reopening of more and more public spaces and public places for folks, particularly focusing on the outdoor amenities first. But as you can see with some of our indoor pools opening, and some of what I'll talk about in a second, we are getting to some of those more indoor facilities as well. And this is all a march through the city's phase 2 reopening, which does roughly align with the province's stages, but we are certainly moving our way through and looking at how we can get more and more of those facilities up and going so that if people do wish to come and be active within our facilities in person, that they can, always doing so with all of the public health measures that we've been talking about for weeks in place. Our pools did reopen yesterday, some of them, and we had a really successful day in terms of the 9 swimming pools and 1 wading pool that were reopened. Have numbers for the swimming pools, not so much for the wading pool because of its the nature of the coming and going there, but in terms of our swimming pools, the indoor and outdoor pools that were open yesterday, we had just over 700 visits, and the feedback was that everybody who wanted to swim was able to, and overall things went well, and people were pretty pleased to have pools back at their disposal. So tip of the hat to our folks in recreation who obviously are doing the work to make sure that these pools are safe and to make sure that people can come and have the fun that they want to, but do it in a safe way. And in order to get us ready Really big thanks to our public health folks and our public works folks who obviously get our pools ready and made sure that our folks were well trained and well positioned to cover all the safety things that we need to. A reminder to continue to look at our city website for all of the times and opportunities for you to enjoy our pools, both indoor and outdoor, and the one waiting pool that is open in Dundas. From our museum side of things, Dunderrin Castle, the Hamilton Military Museum, and the Hamilton Museum of Steam and Technology are reopening as of July 15th. To offer modified programming on a Wednesday to Sunday schedule. So some of our larger museums where we feel there can be good distancing and the ability for people to come and visit, we are opening those sites, and events booked at these 3 sites can still take place as long as they follow all the health and safety guidelines and conform with the provincial orders in terms of size of gatherings. We have canceled all other events at these types of facilities up to September 30th. This would include things like Field Coat, Griffin House, Ancaster Old Town Hall, White Hern, the Children's Museum. Where possible, some of those events may move to the 3 that are open, Dunderrin, the Military Museum, and the Museum of Steam and Technology, but some may not be able to be moved and are therefore being canceled. We are taking bookings, obviously, for the 3 that are open, and bookings for the other 6 museums will also be available starting in the new year for 2021, so people can start to book. And many of these facilities are used for events and gatherings, for weddings and wedding photos and things like that. So we do know that people like to plan in advance, and although we can't offer these facilities, all of them at this point, it is nice to see some of our great museums coming back online for people to enjoy and also use as a backdrop and as a place of gathering for some of the events that can happen under the provincial guidelines and under the health and safety guidelines. There's lots of talk about masks in the community, and so I'll end by talking again about HSR and the fact that masks are required on transit, regardless of what's happening at Board of Health and otherwise. The EOC, in conjunction with Transit, took the action after talking with Dr. Richardson to make masks mandatory on transit. We are increasing the volume of people that are using transit, and of course, transit now is at one point was very, very strictly relied upon by essential workers only or essential trips, but more and more of that is turning into also recreational trips as people get to access things in the community. So more people using transit, please wear a mask. Now, we've actually seen a slight slippage in the terms of the number of people wearing masks on transit based on our visual look at the transit situation from our inspectors or supervisors. So certainly not scientific in nature in terms of looking at counts on every single bus, but our visual experience with this is actually there's been a bit of a decline from the early stage of this to where we are today. So we need to get that back up, and we are talking, into the high 80s, 90% range is what we would like to see on transit, recognizing, of course, that there are some people who cannot wear masks, but that should be few and far between. Staff are still working with DARTS and our local social service organizations to distribute masks, single-use masks to people who need them, and one-time use masks are also available while supplies last at the Hunter Street GO Station, at the HSR customer service ticket counter at the Hunter Street GO Station at 36 Hunter Street. That place is also open, and that window is also open to do all of your other business with HSR, including purchasing and reloading the Presto cards, looking to renew monthly passes, purchasing tickets or taxi scripts for those who need that. And you can also pick up the accessible transportation application form at that location as well. All of our other sites that normally provide some customer service to HSR are still closed. We've only opened the one at Hunter Street. So those are the updates from the EOC today, and I'll turn things over to Dr. Richardson.
Thank you, Paul. So just a few updates today in terms of cases because our numbers continue to be low. We're just at 2 new cases from yesterday, so 856 cases in Hamilton as of 9 o'clock this morning, and 91%, we're over 90% now, 91% of cases are resolved. No new deaths, which is good news, as is the fact that we have no new institutional or community outbreaks at this point, and so we're still holding strong here in Hamilton as we go forward with reopening. I do want to take a moment again to acknowledge that we're having here in the Hamilton some real issues around the amount of time it's taking for some of our residents to get their COVID test results. And we know that there's a lot of anxiety because of that uncertainty. We know that people are worried that receiving a result on time will affect their ability to visit their loved ones in long-term care and retirement homes. And of course, they want to know what their result is in terms of whether it is positive or negative. So we are unfortunately seeing some residents return to the assessment centers, go to a different assessment center instead of waiting for their test result. While it's very understandable that people would want to do that, I would really discourage people from doing so. In fact, what they end up doing is adding to the burden that is going on within the laboratory system in terms of getting the results processed. So rather than improving their turnaround time, they very well could be increasing that time that it takes because of increasing further the backlog and duplicate records and confusion in the system. Within the assessment centers themselves, we are still seeing about 450 people per day. That's well over the capacity they were designed for. And we are working with all of our partners in primary care and the hospitals to make sure that they do pass along the results when they can. However, the actual processing of those tests is done by Ontario's Public Health Laboratory, not to be confused with our public health units or boards of health. And they are the ones that are responsible for uploading the results into the provincial portal. So it does continue to be important that you go to that provincial portal to get your test results. We do not have any other access than what you would have. We would just get your permission to go online and check those same results that you could find yourself. We do know that it's taking up to 10 days to get your results. And in rare occasions, we are hearing that people are waiting even longer than that, 12 days and the like. So if you have been tested, do continue to check online at the portal. You can contact the person who did your test or your primary care provider, but they are by and large using those same systems as well. So for those who are testing positive, we do see their results are coming through more quickly. If they have symptoms, the lab does indeed fax over their results to ourselves, and that's the only time that we're getting results at this point, and the only point at which we would follow up with somebody is when we do get those results, as they're required to do by law. The labs report them to us so we can undertake the public health actions in terms of case and contact follow-up. So we're in regular contact with Ontario Health and with the ministry to try and see what it is that's causing the problem and encourage them to find a solution to it. But making changes in that system is beyond our control. So our empathy definitely with those who are experiencing that, and we're trying our best to solve it, but we really don't have any other explanations or solutions to offer people at this point. So Mr. Mayor, with that, I will hand it back to you.
Thank you. And I can certainly relate to the anxiety that is wrapped around just getting a test, and empathize with those that are waiting, inordinate amount of time to get it, because it keeps everybody on pins and needles and uncertain as to what they need to do or where they need to go or who they need to protect. So I can certainly understand that. And I know that we're doing everything possible to help the labs get the results out as quickly as we can. Before I go to the media, I'm going to just do a shout out to Hamilton Bay Sales on Bay Street North near the West Harbor. As the name indicates, they're a sail maker, but they did get a call from Air Canada in mid-March, and the airline asked if they could quickly manufacture some 300 snug-fitting engine covers for the jet engines of dozens of planes grounded at Pearson Airport due to the pandemic. The engine covers are critical to the integrity of the grounded planes in order to protect them from the elements. So Bay Sales had never made an engine cover before, but they rolled up their sleeves and came through for Air Canada. Another example of the entrepreneurial can-do spirit that exemplifies Hamilton Industries. So congratulations to Kevin Piper and his entire team at Bay Sales. Mr. Music in Hamilton, Boris Brott, has continued to provide concerts throughout this pandemic. Since May, the Brought Music Festival has been live streaming its Brought Music Live series on its Facebook page and YouTube channel. It happens every Thursday at 7:30 p.m. Boris Brott has also responded by taking his critically acclaimed National Academy Orchestra and Brott Opera programs online. That's good news for 41 apprentices with the National Academy Orchestra and 14 emerging artists with the Brott Opera. It means that they will be employed as usual for their summer music program at a time when many other musical artists around the world have been idled by the pandemic. All Brought Music Festival programs are live streamed to the public for free. So dial in 7:30s on Thursday. Music, as we know, is more important than ever during this challenging time. And thank you to Mr. Music, Boris Brott, who's been bringing music to us for 40 or 50 decades at this point. And thank you to your team as well for supporting the next generation of classical musicians during this pandemic and for keeping the music alive. Thank you again as well to our frontline essential workers, our nurses, nursing home staff, cleaners, grocery store workers, truckers. Everyone is going above and beyond during the pandemic to keep our city and services functional. We appreciate everything you're doing out there. And I know that, and I hope and trust that after this pandemic has subsided, that the appreciation and respect and that you deserve and income that goes with it will be appropriately adjusted to continue to compensate the people that are working in these situations equitably and fairly going forward. At this point, I'm going to turn it over to Jasmine Graham for media questions. Jasmine?
Thank you, Mr. Mayor. We have 7 media on the phone today. We'll start with one question and one follow-up for everyone. First question to Bobby from CBC Hamilton. Bobby, you can go ahead.
Hello, I hope everyone is doing well today. My question is for Dr. Richardson. So, hi. As I just heard you say, there's roughly 450 people a day, I guess, getting tested. Do we have the number of people who are going to these testing clinics and asking for their results while they wait?
Hi, Bobby. No, I don't believe any of them are actually going back to the testing clinics to ask for their results. What I understand is we are certainly getting lots of phone calls through the booking line asking whether or not we have results for them. And we know that their family doctors are getting calls and the hospitals who are involved are getting calls. Everybody are getting those calls. I think when they're going back to the assessment centers, it's when they're wondering if they should go ahead and have another test in order to get a result. So we know that the province has in place a requirement that visitors be tested every 2 weeks in order to see their loved ones. And so that timeliness around the results is really important for them and is probably part of what's driving that as well.
So okay, so they're not going back. So they're getting some people are getting 2 tests. Is that, maybe I misunderstood you? Is that what you were saying? Some people are getting multiple tests?
What we're hearing from people is some of them are going back to the assessment center to get a second test because they haven't got their result, and in hopes that that result will come more quickly.
Oh, okay, I see. Thank you. And my other question was, you had mentioned that 91% of people have recovered, and there are no more people in hospitals right now. That's, at least right now we can see from HHS and St. Joe's, and that's definitely a change from the start. So what are you thinking seeing those numbers? It seems to be a step in the right direction.
Absolutely, Bobby. Thank you. Yes, we had 1 hospitalized as of this morning. So if St. Joe's and HHS have updated their sites, that means, even more good news. So overall, we're doing well. I mean, Hamilton has done well. Ontario has done well in terms of getting this virus under control. We have had some, of course, challenges that have arisen from time to time as we first had this experience with long-term care homes and retirement homes. Then we had the experience with temporary farm workers in other parts of the province. And so we're all learning in terms of how this impacts different sorts of situations. And, we'll continue to do that. And we'll continue to look at other areas. What are the challenges they experience? What are the things that they put in place that are needed and can make a difference, and continue to look at what we can do to be proactive in terms of addressing this virus. So very, very pleased with our experience, very pleased that people can, get back to work. We can reopen. We can, look at the many other issues that affect people's health other than COVID-19 as we go forward, that people can get their surgeries done that they've been waiting for, all of those sorts of things. So we hope to continue to see that progress. The numbers are encouraging, and then we can continue to monitor and follow along. And if there's tweaks we need to make, then we'll make them as we go.
Thank you.
Thank you, Dr. Richardson. Next question to Tevia from the Hamilton Spectator. Tevia, you can go ahead.
Thanks very much. This is a question for Paul. Paul, I'm curious about how you think the city will go about enforcing the mask bylaw, assuming that it does pass through all the hoops at City Hall. What will the approach be? I'm just curious because you mentioned that you saw some slippage in the compliance on the HSR, which sort of suggests that it's not an easy thing to have people follow.
Well, first and foremost, I think the fact that it's a bylaw now and it's mandatory, so the EOC and Dr. Richardson and myself and whatever saying it's mandatory, there really isn't much behind that. Now there will be in transit. It will be our recommendation that transit is captured within this bylaw when it comes to the Board of Health. So I think the fact that this is a bylaw, much like the bylaw that was passed by Council in early April around physical distancing, sets in place that this is not just a desire. This is not people in positions saying you should do it. It's actually now something that has some teeth behind it. But definitely this is about education. This is about why we're trying to do that and encouraging people to do it. We do not have enough, I've said this many times, we do not have enough bylaw staff, and we are not hiring new bylaw staff to go to every indoor space, to go to every, be on every bus and be in transit shelters. That's not the approach we're going to take. But what this does allow us to do is monitor and have feedback provided around where things might be pretty egregious. And the example I'll use to make it real is that during the height of the crisis, when we were in a fairly strong degree of stay-at-home mentality, we did receive information about businesses, for instance, that were simply packing people into their lobby and their waiting area for takeout and making no effort whatsoever to keep people physically distanced, and they just didn't care. And so we laid some charges. We did attend house parties where it was pretty clear people just didn't care. They were inviting over, this was well before social circles. This was 30, 35 people having a house party when we were supposed to be staying at home, close to home, on our own or with our immediate family. And so we attended those. Did we go and knock on every door? Did we check in every backyard? No. And so I think this will be very much in line with that. If there are areas where there are egregious examples of people, choosing not to protect others from themselves by wearing masks, then we may have to take some action, and that action is justified should this bylaw come into being. So our approach will be, as we have throughout this pandemic, to really be there encouraging people to understand why this is occurring, why we have made it mandatory, and do our best to help people understand it from an education standpoint. But this does give us the teeth that if there are examples and complaints that come in or issues that we observe that need our attention, we will go and do so. And I would say that's not much different than some of our other bylaw approaches, whether it's at waterfalls in a normal summer or in other places where we see some hot spots and we go and do some proactive enforcement. There may be some of that, but I think the biggest piece of this is that this is a strong statement. Should this be adopted by council, this would be a strong statement by our council that this is, again, not people asking that it be done. It's now a bylaw.
Sorry, here's my follow-up. I guess the question I would ask is the origin, sort of the genesis of the why. What crystallized either staff or Mr. Mayor the political decision to pursue this bylaw? I know initially there was sort of a let's wait and see period. So what really what's the thrust of this? Where did this come from?
Shall I start that one, Mr. Mayor?
Yeah, go ahead. Yeah.
So I think what we've been recommending for some time now has been that masks be worn, where you're unable to physically distance, that it is seen as a control measure that can really make a difference. And the evidence on masks isn't entirely clear. And so we're mindful of that and go to the level of a recommendation as the evidence gets better. And it's still not completely clear, but some additional studies have continued to come out that suggest that masks do make a significant difference, could reduce the level of transmission. Because remembering we're we're masking to do what we call source control, which means that my mask is protecting you and your mask is protecting me. It's not there to protect ourselves. And so that there is evidence, continues to be increasing evidence where those, they either have a culture of mask wearing already. So some countries already had that culture in place, or where they've been mandated, that there is a reduction in the transmission of the virus. And so as more evidence came out, that it made a difference, and that the sort of level at which people needed to mask was probably, we initially thought about the 60% range, it may be about the 80% range, that to get there, the mandatory masking, as some have used it, or requiring face coverings to be utilized could help to increase those rates. And it's definitely a signal and a message to people that COVID virus is still here, that there are important things they need to do. It can also potentially help people to do the other things and remind them to do the other things as well as masking itself, like keeping physical distancing and those sorts of things. So as the evidence improved, we talked about it, we continue to talk about these things across the province, and looking at areas where we have more people who are in higher contact. We've seen more of us start to move towards that recommendation through one means or another to recommend either a bylaw approach, or in areas where they've actually had outbreaks that are directly related to it. You've seen some Section 22 orders as well. And so we had some specific outbreaks in Ontario where we thought it really could have helped.
Thanks, Dr. Richardson. Next question to Joey Coleman from the Public Record. Joey, you can go ahead.
So, Paul Johnson, you're saying that the number of people wearing masks on the HSR is actually declining. So what I ask is, when will you release the information that you have that showed the numbers you gave us last week, where you got those, and the numbers you're giving us this week? All I'm asking for is simple transparency so that we can verify what you're saying.
Yeah, simple transparency is it's done the same way. It's inspectors and supervisors doing visual queuing of this. That's how it was done. And early on, the range was 70 to 79%, and now it's drifting more into the 60%. More people are using transit. Remember, in the early stages of this, we were still in a lower usage mode of transit. Now we're in a higher usage mode of transit. So the numbers come down, and our experience and feedback from drivers and others is that it varies quite a bit. We have some where it's being reported as very low, and then other places where it's reported as much higher. So there is no data source. So we don't use counters. It's not part of our automatic count system or anything like that. It's been done visually, primarily through inspectors and the supervisors, and also, communicating with drivers, but it's not an expectation. It's not a requirement of drivers to feed back data. So this is in some ways anecdotal, and in other ways not anecdotal. This is a visual approach to providing some of that information, and it was a good litmus test to see where we are. We slipped a little bit, and some of that's because more people are using the transit system, and perhaps not quite as in tune with what needs to happen. Obviously, we're going to shift this under, the goal is, if it's passed by the Board of Health and by Council, is we'll shift this under the bylaw, and it will, the HSR, all of our HSR buses will fall under this bylaw moving forward.
So I've been out with my camera taking stills of buses as they're passing and counting, based upon those stills, the number of people masked on the buses. Again, I'm getting between 30 to 60%. I didn't see anywhere 75. I don't think that this is being communicated to you verbally. I would assume that this is coming in some sort of written format. I'd like to get a sense of the data that you're working with so that I can cross-compare with my own and accurately report what we're all seeing out there. So that's the request, is for that information. Thank you.
So Joey, it's an email. There's nothing to provide you. An email from HSR. I said, what's our rate look like? They said, hey, our inspectors and supervisors have been looking. It's around this amount. There is no data source. We're not taking photos, doing those types of things. So there is nothing to provide in terms of what we received is an email from it. And maybe on reflection, those are things that are meant to be helpful in terms of gauging what's going on. Maybe it wasn't overly helpful because, as I say, we're not doing it as a standardized approach bus by bus. So there is some variation, and this was meant to give some sort of a snapshot of where we were, but there isn't anything else that we can provide in terms of a more transparent piece. I asked prior to our the one press conference when I talked about it for what a sense of numbers was. I received that. I've received a slightly lower number in terms of preparing for another press conference, and that's it. We're not looking at it from a percentage point, and going forward, you know, probably stop doing that. This was it's supposed to be a bit of a gauge, and of course we hadn't at that time contemplated a mandatory masking policy and bylaw across the entire city, so that will definitely shift once we move into the bylaw territory.
Thank you for the explanation. Much appreciated.
Thanks, Paul and Joey. So next question goes to Fallon Hewitt from the Hamilton Spectator. Fallon, you can go ahead.
Hi, I have a question on mandatory masking. So what are the indoor spaces where masks will be required?
Hi, Fallon. We're just actually finishing up this report. It's not quite put to bed. So until it gets there, I can't really go over that kind of detailed information for you. But it is going to be public spaces where the public has access and those sorts of spaces. So we won't delve into, things that are strictly workplace issues because those are already covered by the Ministry of Labor, or things that are covered by another provincial jurisdiction, such as schools and daycares and those sorts of things. So that's the sort of top level general statements, and then you'll need to wait till the report is put to bed and you've got it on your docket from my perspective tomorrow.
And I had a second question. The mayor had mentioned wearing masks outdoors. Will that be a part of it, or was that just a clarification issue?
Mr. Mayor, I don't recall exactly what you said.
Nor do I. My memory's really good, but it's very, very short. So, so remind me, Fallon, what are you referring to?
Oh, that was just an earlier comment.
Yeah, you know
where-
what? I think what I said was that if you have underlying health issues, that it's probably a wise choice to wear a mask in any event, if you're outdoor spaces or anywhere else. And I see a lot of elderly people taking on that practice, and those are the people that, and whether you're elderly or otherwise, if you have underlying health issues and if your immunity is challenged, then you either stay home or you ensure that you protect yourself with masking wherever you are. So that was the point of that comment. I wasn't suggesting that we were making masking mandatory in all outdoor spaces, but for those that feel more comfortable in doing that, there shouldn't be any shame in doing that. So that added level of protection is never wrong in any situation.
Okay, thank you. Next question, we'll go to Matt Ingram from CHCH. Matt, you can go ahead.
Good afternoon. Thanks for taking my question. I really appreciate it. My question is for Dr. Richardson. I was wondering if you could just kind of take me through some of the thought process that went from, a few weeks ago when we were talking about masks, you were saying our numbers are so low and, we really have some time to think about it and make sure we do the right thing. And now we're coming up to a point where we're going to see some of the results of that work. And I was wondering if you could just kind of talk to me from where you went from, not committing to, yes, we should have masks, to, as you said, recommending, to now we're going to a place where mandatory masks is on the horizon.
Sure, absolutely. Thanks, Matt. This has been part of the dialogue. It's funny, I think about my colleagues from St. Joseph's Hospital talking about this actually right back at the very beginning of this with Winnie Doyle, who's one of the vice presidents from St. Joe's, talking about the importance of these masks and how they might be able to play a role in this response. So we certainly have been talking about this all the way from the beginning. We've had the recommendations from the Chief Public Health Officer for Canada around recommending masks as we go forward, and people have been following it around the world to see what the experience has been, and we've been following it along with them. We've had the great fortune of having a couple of public health doctors in training who have been giving us monthly updates on sort of global evidence on public health measures and measures against COVID-19 and what can be done about it. And so this has certainly been one of the things we've been following very closely as we go forward as to the impacts that it has. At the same time, we're also watching our own local epidemiology and looking at what are the key risks that we're seeing are leading to more COVID-19 cases here in Hamilton. And certainly for us here in Hamilton, it is that household spread that, or spread amongst people who are living in the same housing, that such as roommates and that sort of thing, that is the biggest driver around spread. But we do see, when we look at the epidemiology more broadly, that masking can make a difference in bringing those case numbers down, reducing transmission, allowing us to get back to doing more things. So countries where they have implemented those measures, often the degree to which they have to do lockdowns or things of that sort of nature have been reduced. And as we're looking at the longer term and how we're going to go forward and live with COVID-19 in this world, we're trying to look at what are all the measures that can help us to get there. So as the evidence has gotten stronger, still not definitive by any means, but stronger around mask wearing, and with some critical additional studies coming out the last few weeks, we've made the change and decided to move forward with the recommendation to go to a bylaw approach to masking rather than just a recommendation.
Thanks so much. And my follow-up for that would be also, we're seeing a lot of cities around Hamilton kind of moving in this direction as well. Burlington, St. Catharines, Toronto, just came online today. For masking to be an effective kind of second barrier, how important do you see a regional approach to this? Like if Burlington and St. Catharines say no and Hamilton's just an island in the middle, is that going to impact its usefulness?
Well, it's a good question, Matt. And as we've gone through this experience with COVID-19, we've seen us try to understand what we need to do as a consistent approach everywhere and what we can do regionally and locally in terms of the response. And certainly, as we've moved forward, we started to see more of this regional adaptation to what's actually going on in each area. And in fact, as our residents went through and looked at the global experience, that's also being echoed out in the broader world in terms of making sure that we're addressing the issues locally in terms of what are the greatest drivers. So when it comes to mask wearing, it is one of the things that is effective. And so you are seeing people across Ontario in different areas. There's people in the north, you'll know in Sudbury, they made recommendations there, even though their case numbers are lower than they are down here in the southern parts of Ontario. So I think in each area, it is a discussion that each community is having, and you're going to have a little bit of difference. And that's a good thing. It reflects the community and what it is that they see and want to do to deal with this virus, because it is very much the community impacts that are being had. So there may be some variability, but ultimately, here in Hamilton, we're going to have to do what we think is best for Hamilton in terms of the recommendations you'll hear from staff, and as well in terms of what council ultimately decides.
Thank you, Dr. Richardson. Next question to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks for taking my questions today. My first question is for Paul Johnston, and it's going back to people removing the signs and the tape from the playgrounds. I'm looking to see, are you putting the tape and the signs back up, and why or why not?
So signs definitely need to be up. The tape is an issue of staff resources now, and quite frankly, we're challenged to have enough staff resources to pull off to put tape up regularly. Both the weather and people could take down the yellow tape, but signs will be replaced. I understand that has been fewer of the things that have been removed. It's been more of the yellow tape getting, if there was yellow tape left, it was getting, or caution tape, that it was getting ripped down. But we're, the other piece is we're trying to ascertain just how long this is going to be closed. So the signs need to be there. They're very clear indicators that it is closed. But if we're to pull people off other pieces of work in Public Works to put back the caution tape across every single one of our play structures, that means other work isn't getting done. So our challenge right now is more of a person power issue than it is anything else. And that's why we put the signs up. We knew the yellow tape would both blow away over time and potentially get taken down. So the signs are there, and they are the ones that will be replaced for sure. We're still not convinced that we're going to be able to do the caution tape work, and would hate to be doing that and then turn around and have the play structures be open and have wasted some of the staff time that could have been used to do other things. We're down a number of positions in terms of our student hires in Public Works, and we've got lots of work to catch up on. So it's a balancing act now, whereas in the early stages of the pandemic, we weren't doing much else. And so there were lots of crews available to make sure that these closed facilities had lots of signage and tape around them.
Thanks so much. And my second question is for Mayor Eisenberger. I'm looking to see, can you be more specific about what cuts that we'd be looking at in Hamilton if this emergency funding doesn't come through?
Well, we haven't defined that yet. That's a reports that are coming back to council at some point, I imagine, probably in the September timeline. Obviously, cuts. We're hoping not to do them, quite frankly. But clearly, if we're going to do service cuts, then it'd be very, very difficult to determine where they ought to be, what projects we shouldn't do this year. But all of those options are being looked at. I can't predict where our Mike Zagaric and staff might come to in terms of that conclusion. But there's also the other option of, going to the tax base and making up the difference, or doing a bit of both if we have to. But that's not the objective for us at this point. Clearly, the feds and the province have collectively and individually helped, in huge sectors of our economy for all the right reasons, to ensure that people stay employed and keep the economy robust, and hopefully coming out of this with a solid economy to work from. Not providing the offsets for municipalities or the resources for municipalities to deal with this deficit is going to be a detriment to the future economic well-being of all of our cities. So we're hoping that the feds and the province come together and make a significant investment in the shortfalls that are happening right across the country. Again, for Hamilton, right as we speak, it's $60 million. If it goes to the end of the year, and it may, who knows, we're at $120 million, and it varies from municipality to municipality right across the country, but each and every one of them are looking at a significant shortfall deficit for their upcoming budgets. So, you know what, I can't predict what all those cuts are going to mean, but they're not going to be pleasant, and any potential tax increases are not going to be desirable either, but may be necessary, or a combination of both. And we're hoping to not do either one of them, so that we can get the appropriate offset to make up for this shortfall that we're experiencing, that the feds and the province can help us with.
Thank you, Mr. Mayor. Last question to Katrina Clark from the Hamilton Spectator. Katrina, you can go ahead.
Thank you. My question's for Dr. Richardson. So with people who are trying to get tested right now so they can go and visit loved ones in long-term care retirement homes, with it taking them about 10 days or more to get their test results back, and in this time, they're out in the community, they're living their lives, doesn't it render this test a bit useless in terms of serving the purpose of trying to show that these people don't have COVID?
Thanks, Katrina. I'm just making sure I've got your double negative there the right way. I wasn't sure if you were going to say, doesn't it render it useless around cases as opposed to helping with getting people to visit. I just want to be clear that when it comes to cases, we are seeing a faster set of results on positive cases, and those are being faxed through us. And I think that's part of it, is they're handled a little bit differently than the negatives are from what we see. But absolutely, as you've said, when it comes to people trying to visit their loved ones and the testing, it is understandably very frustrating that it's taking this long to get the results. And that's why we've been, trying to work with the province to see what they can do to improve this. I don't think this is a situation that anybody would want to have happen. And we're trying to understand what the underlying issues are. But ultimately, all we can do is raise those to the province, to the lab network, and hope that they can get addressed and reduce those times so people very much can get out to see their loved ones.
Thank you. And in terms of people going back and getting a second test, I've heard from a few people who have done this, and a lot of them, it's like day 12 that they're going and getting the second test, and sometimes that test turnaround is 2 days, and then that gives them an extra 12 days to be able to go visit someone in long-term care. So what do you advise people to do if it's day 12 and they have 2 days left to be able to fill that requirement?
Well, absolutely. If they're coming up to that requirement where they're going to need a new test anyway, we can understand why they would go back. I think what we're trying to discourage is people at an earlier test point, or earlier point in that waiting for results to go back earlier on, because it's, in essence, it's just continuing to get more backlog into the system. And not necessarily hurrying things up. But absolutely, if you're nearing the time where you're going to need a new test, in any case, because that 14 days is expiring, I can understand why people would be going for it.
Thanks, Dr. Richardson. Mr. Mayor, that's the end of our media questions for today. So I'll pass things back to you for some closing remarks.
Thank you very much. And again, thanks go out to Bill Custers and the entire team and McLean Media for ensuring that these availabilities run as smoothly as they have. And much appreciated to the media for being part of this, as well as the folks that are listening in live stream or through Cable 14. Thank you for tuning in. And just to remind everyone that, as much as there are more areas of good news coming forward, that virus is still very much part of our community. The mandatory masking is an added protective measure that as we open more things up, we would need to continue to minimize the risk of spread. And so I'm 100% confident that Council will approve that and get that in place so that people have a greater comfort level when they're out in the broader community, in places, confined spaces or places in retail when they start to open up more aggressively, that they'll have a measure of protection that they can provide and others can provide for them. And I think those are the right steps to take. And I have to be honest, many businesses are already have taken these measures that will not allow people into their stores or their locations without a mask on, and that's appropriate. So what the business community is looking for is consistency across the board, and certainly the masking face covering measure will do that. And it will continue to remind us that as long as the vaccine isn't out there and as long as this virus is out there, we are going to be challenged with this new normal that we're dealing with going forward. So Hamilton, stay the course. Keep doing what you're doing. We've done exceptionally well, relatively speaking. In no terms is 40 deaths a good thing. But compared to what you see happening across the border and in the United States, where they have been opened and have been opening up and are now reverting back, I've heard from many businesses that have indicated to me that if they have to close again, that might be the end of their business. And so we don't want to be in that space, and we need to put all the protections in place, as many protections in place as possible, to avoid anything like that happening here in Hamilton and in their province and in our country. So thank you, Hamilton, for all the good work you're doing. Thank you to all the public health workers, and thank you to Dr. Richardson and General Manager Paul Johnson for your answers. And thank you, media, for the questions. Have a good day. We'll see you on Friday.